Yes, I do see that we're live, Monica. Thank you. All right. Good morning, everybody. Bright and early Tuesday morning. So to start out here, I will introduce myself. I'll go through and tell us a little bit about the organization. We've got a couple of short little guest speakers here, and then we'll get started with the Q&A. I want to mention, because I always forget this in the very beginning, anybody that is watching or in here in Zoom with us, if anybody does have questions or comments throughout, please feel free to drop those in chat because we will try to get those to the panelists during the discussion. So to give you an intro, my name is Nikki Caboose. I'm the VP of Development for Tech Hub South Florida. And I'm going to go ahead and share my screen here, give everybody a little bit of an overview if you guys are not familiar with the organization. There we go. Tech Hub South Florida. So this morning, we've got our community coffees, which are our panel discussions. We hold them every other Tuesday morning at 8 a.m. This is part 2 of our Health Tech in 2050. There is going to be a series of, I believe, 4 we've got planned right now until the end of June. And our 3 panelists this morning are Dr. Sarah Rushnick, the professor, I can't talk this morning, Business, Tech, and Health Informatics at University of Miami, Dr. Stephen Bronsburg, Director of Biomedical Informatics at Nova Southeastern University, and Dr. Tala Mirzaei, Assistant Professor of Information Systems and Business Analytics at FIU. This discussion this morning is presented and sponsored by South Florida Business and Wealth. And we do have Beth Wagmeister here with ASL interpretation. She is doing a very wonderful job of helping our organization become more inclusive. And I would definitely say for anybody that's watching that's part of the business community or does have an organization like ours for events, to please reach out to Beth. She's helping us very much as an organization. Again, our sponsor, South Florida Business and Wealth, and I know Mark is here with us this morning, so once I am done with this slide, I will definitely give you a moment, Mark, to tell us about some exciting news you guys have coming up.
Great.
So building South Florida into a tech hub, this is our mission statement. We know that this takes a lot of people, a lot of partners, so I want to read everybody here our community creed. So Tech Hub South Florida is wholeheartedly committed to building a welcoming, collaborative, and inclusive community for all. We put inclusivity first, engage with others, are considerate to all, and don't sell to people. So in short, we want to make sure that everybody is invited and welcome to the table. And again, this morning, like our health, tech, and life sciences group, which we're going to have Pete tell us a little bit more about this morning. This is a new group for us, so we want to make sure that anybody that is within those areas that we do welcome to this, and we would love to hear more from you all. So Tech Hub South Florida, again, our mission is to build South Florida into a tech hub. And we are a nonprofit 501c6 membership-driven organization. We have over 200 corporate members currently, ranging from Miami-Dade all the way through Martin County. And of course, once you include all the individual members and wonderful, talented professionals, we've got thousands of members and partners throughout the region. A few of our companies here, Boca Code, Office Depot, City Furniture, Florida Crystals, Jupiter Medical Center. I mean, we've got a ton of different companies from startups all the way through enterprise level. A little bit on the membership. Again, I won't get into this in detail. Don't want to bore anybody at this moment, but we do have 4 different corporate membership levels, you know, from different benefits such as like member access, to peer groups, job listings, speaking opportunities, and so on. But if anybody is interested in learning more, I'd be more than happy to send you guys some information or set up a call with anybody. A little bit about our weekly events. So on average, in a typical week, we've got Tech Talks on Monday nights, which, by the way, the first time in a year since the pandemic, we are going to have the first one coming up May 10th, back in person, doing that at Boca Code. And we have our community coffees, which are our panel discussions like this morning. Those are alternating Tuesdays. On the alternate Tuesdays, we actually have our podcasts with different technology, business, and startup leaders across the region. And then finally, our lunch and learns are always on Fridays from noon to 1. For anybody that is currently looking for a job opportunity, on our website at techhubsouthflorida.org, we actually have a job board. But if for some reason you're looking through the job board, you don't find something that is perfect for you in that moment, we do have a resume distributor where you can go and just upload your resume. Once you hit submit, it goes through to all of our member companies and any organizations that have signed up to receive that service. And for anybody that's interested, we do have a pretty active Slack channel. I think we've got about 4,500 members on there currently. To join, that's just techhubsouthflorida.org/Slack. And then finally, we do have an e-newsletter that goes out every single Monday afternoon. Lots of tech, startup news, events, just a lot of things to help keep everybody kind of in the loop with what's going on in our tech ecosystem. You can actually just text your email address to 561-250-7206, and you'll automatically be added to that e-news list. And last but not least, I want to invite Mark from South Florida Business and Wealth to speak a little bit as they are the sponsor and about this new Excellence in Healthcare Awards coming up as well.
Great, thanks, Nikki, and good morning to everyone. We're excited to be a sponsor of today's event and our ongoing events as well. A little bit about the South Florida Business and Wealth. What you see up here is our Healthcare Awards. That's one of the many things that we do as a company. We're having a special event on May 19th. It's still virtual. We're going to be providing and honoring about 40 to 50 professionals in the healthcare industry. It's one of about 10 different awards events we do during the year. We also have an awards event for the legal community. We do something called Diversity and Inclusion Awards, which we're launching this year, and also have an awards event called the Apogee Awards, which is for C-suite executives. I'll try and be brief. I'm not really good at being brief, but I'll do my best because I know we have an exciting event today. Just a couple of other things about South Florida Business and Wealth. We really serve all of the South Florida business community and help connect business professionals through a lot of different platforms. In addition to our magazine, I mentioned the awards events we do. We also connect people through our digital and social media strategies. And we're pretty excited to, as Nikki mentioned, a relaunch of some in-person events. We will also be doing the same. We're relaunching our very popular, what we call our CEO Connect events, which are monthly networking events for C-suite executives. We'll be relaunching that event in June. And we also are relaunching a celebration we do every year for the legal community. We produce a legal guide called the South Florida Legal Guide annually. And in November, we're having a big event at the Museum of Discovery and Science for a couple of hundred in the legal community. And if anybody on this call today is interested in getting connected in any way, shape, or form with other top execs in the South Florida community, please reach out to me. And Nikki, thanks for the opportunity.
Of course, thank you so much, Mark. And Mark, I did drop the link to the Healthcare Awards in the chat, but if there's any additional information that you'd like to drop in there, please feel free to do so.
Great.
And again, thank you so much for South Florida Business and Wealth being a sponsor of this. We really appreciate it.
Our pleasure.
And I would like to briefly pass this to Pete Martinez. He helps us chair our healthcare and our health tech and life sciences new committee. And I'd love for him to talk a little bit about that committee and what we're trying to do there. And I think that would be really good to kind of pad this conversation so everybody knows, what we're doing here.
Good morning. As an introduction, my previous life, 32 years with IBM, I was the vice president of the consulting group for IBM. Now I'm the CEO and the chairman of the HealthTech family of companies at the intersection of health and technologies. Specifically with this organization, what we're doing is health and healthcare is the largest industry in South Florida, in Florida and the United States. So because of the massive growth that we're experiencing at the intersection of health and technology, we thought it would be very appropriate to create a focus around it. So there are three key missions to it. First, take inventory of everything that we have around us, all of the companies, the talent, and the initiatives related to it. The second one is create a network so that we can start the communication between the different players from academia, from the business sector, from the public sector related to it. And third, start leveraging the assets that we have. So more efficiently leverage everything from financing to the different structures, the different infrastructures that we have. So this group is a perfect reflection of it, because the trending now that we've seen on health, everything from the telemedicine to the new drug discovery to the orthopedic and robotics. But one of the keys is the analytics related to health. This is the next big thing that's happening. So artificial intelligence, big data, and analytics is a real reflection of where we are now. We're very fortunate today to have panelists that reflect that. The question was, who typically resides in these type of conversations? It's a combination of the scientists, the technologists, and the business people. You cannot have 2 out of 3 and run a successful enterprise. So our objective here is to bring the science to market with the highest degree of quality, the highest efficiency through the technology, but also the most sustainable business models. Thank you.
Couldn't have said it better myself, which is why you were the perfect person to say that, Pete. Thank you. Sounds a lot better coming from you than me. All right, well, thank you again, both Pete and Mark. And I'm going to get right into the Q&A here. And I would like to start out, actually, if each of our panelists could briefly just introduce yourselves, tell us a little bit more about your role and where you come from, and then we'll get right into the Q&A. And I'm just going to start with who's first on my screen. So Dr. Sarah Rushnick, if you would like to introduce yourself. Oh, you're on mute.
Hi, can you hear me now?
Yes.
Good, good. First of all, I want to thank you for inviting me. I really like the idea that your organization was focused on Palm Beach, and now it's broadened to South Florida. And I really think that's the way it's going to become, is that we really need to broaden that scope. I'm Dr. Sarah Rushnick. I'm a professor at the University of Miami, and I guess I can say I wear many hats. I'm in the School of Business. I'm a professor in business technology department. I'm also a professor in health informatics, and I'm also in the medical school with our group in translational research. And for those of you that don't know about translational research, it's basically bringing our research in the medical school to product. So I work with a number of physicians, a number of executives in the medical school, and helping them actually say, okay, now we have this research, let's bring it to product here, and mentoring them along the way. I'm also involved in the community and also internationally and nationally with a number of companies from Fortune 500 to down to startups, and mentoring and helping those. So basically it's a role that I guess just like Pete said, it's basically a role that I'm taking on too, of combining that data analytics and forecasting with also having the human side, and basically thinking about the best outcomes. We always forget that tech for tech's sake, but what do we want in any part of technology is getting the best outcomes. So thanks for inviting me.
Of course, thank you so much for being here. I've got next on my screen, Dr. Tala Mirzaei.
Good morning.
Good morning.
I'm very glad to be with you this morning. Thank you for inviting me to this event. And I hope we can have a very productive conversation. I'm Tala Mirzaei, assistant professor at the College of Business at Florida International University. I teach healthcare quality and outcomes as well as analytics courses at the FIU Master of Science in Health Informatics and Analytics program. My research is mainly around health information technology and analytics, focusing on improving patient engagement, using different technologies, and enhancing patient-centered care. So those are the things that I am mainly focusing on.
Perfect. Thank you so much. And I'm glad to have you join us as well. And of course, last but not least, Dr. Bronsburg.
Hello, hello. Thank you very much. Good morning, everyone. And wow, I'm very happy to be here. This is very exciting. This is an exciting event, timely as well. I am a professor at Nova Southeastern University in the Dr. Karin C. Patel College of Osteopathic Medicine in the Biomedical Informatics program. I know it's a mouthful. We also have a brand new undergraduate program coming up starting in, well, it'll be mid-August of 2021. So we're very excited about that as well. I'm involved in the community. I sit on the board of HIMSS, the local chapter here. So we do a lot of work in the area of technology and health informatics, and it's what we are. We live and we breathe that. In my role as a professor, I'm very instrumental in many components of the department, and one of the areas I work in is I'm actually the director of the practicum for our students. So I really have that connection with the community and that link with the community and getting our students out there and working with them in these win-win situations. But that's very exciting, and hopefully we'll get a chance to expand on that a little bit more with some of the questions. So thank you. Welcome.
Yes, thank you as well. So I am going to go right into it with the questions here. I've got the first one is actually for Dr. Rushnick, and just as well, even though I'm addressing one person, by the way, if any of the panelists would like to add to that, please do so. The discussions always seem to go better when you guys talk to yourselves anyway and kind of add, so please feel free. But Dr. Rushnick, the first question here is, so to set the foundation for this discussion, can you explain to the audience what exactly is health informatics for those that may not know?
Okay. Health informatics, you can think about it, it's around data. And anything around data in the terms of acquiring the data, it's traditionally been in storing the data, in retrieving the data, and using it again to better collaborate, to get better, as even Tala said, customer engagement, getting closer to the patient, to be able to get the most efficient, most effective care at the end, better outcomes. So it's been changing throughout. When technology has been changing, it's also been evolving. So you can think about it, anything around data. And then later on, it's been changing towards predictive, towards analytics. All of you have heard artificial intelligence, machine learning. So that area in terms of not only seeing the patterns in the past, but forecasting what's going to be possibly in the future. So it's an evolving field, and it basically, you can think about it as we always have, is data is king. And in here, we're dealing about that data in the realm of health, and that's why it's called health informatics, and it's evolving.
Perfect. Does anybody want to add to that, or is everybody just in agreement that that is a awesome description? Thumbs up. Okay, perfect. All right. Well, thank you so much, Dr. Sarah. We'll move on to the next question. It looks like you did a great job with that one. So, Dr. Bronsburg, what type of problems are dealt with using health informatics, and can you give us an example?
Yes, health informatics is virtually in every component of healthcare when you think about it. And I can best give you some examples that'll kind of highlight that. So I'll give you kind of a shorter example and a longer example. First example is, a while back I had a student doing a practicum. She's now a physician, and she did her practicum and she developed and implemented an app for protocols and standards, orders, treatment, long-term care, and home health pocket protocol book was the name of the app. So it gave folks out in the field doing home visits, and I know we think home visits, but the office she was working in did a lot of telemedicine. So this is a quick reference guide for folks to be able to look at signs and symptoms of the patient, what they're presenting, standards, tests, and initial workups that would need to be done for that particular patient and what they were presenting, standard treatments, and admission criteria. So that's one basic example. I'll give you another example. It's a little bit more involved. So let me just set the tone a little bit. So we have a 68-year-old male with multiple comorbidities, high blood pressure, high cholesterol, breathing issues, obese, renal issues, and they're smoking. So the vital signs obviously are not very good for this individual when we look at pulse rate and temperature and respiratory rate and all that. Over the course of 5 months, this individual had 6 admissions and or readmissions. Now, this is a true story, and I'm covering up all the PHI as much as I can. So in we bring the PCP, which was contracted out through this hospital, your primary care physician. So this primary care physician visits the patient at home, okay, and does a workup on them, you know, what they can do at that point. And they notice, you know, there is really a severe shortness of breath. So now the question is, you know, what do we do with this patient? Do we readmit them? Or, well, the PCP said there's really no pneumonia. It's, you know, there's no really pushing factor to admit this person into the hospital. So the next step would be, let's bring them to my office, the physician's office, where they can do a little bit more of a thorough workup on this individual. There they find out, you know, the chronic heart failure is really a major issue for this individual. It's somewhere where near about a class 4, which means that even sitting breathing is a little bit difficult. Okay, so this person is really a sick individual, you know, dealing with a lot of issues. So last time they were admitted to the ICU, they were in there for 14 days. They came in on a stretcher, the eyes rolled back. They had to shock them to bring them back. You know, the signs just were not very good. So the electrocardiogram shows that there was an incident of the ventricular tachycardia. So the choices, what do we do? They're talking hospice, skilled nursing facility. So the physician said, you know what, let's do this. Let's do home care with remote monitoring devices and telehealth visits that are warranted, as well as in-person visits by a nurse practitioner. So that's exactly what they did. Very aggressively, you know, they worked with this individual and treated this individual, you know, for their chronic heart failure, their chronic obstructive pulmonary disease, the renal issues that they were dealing with, the CRF. The results, no admissions or readmissions over a 16-month period, which was a huge success. And, you know, we did not get a readmission with that individual who they were basically looking at putting into a hospice or a skilled nursing facility. So that was just telling you right there that they were not looking at a long-term for this individual. So again, you know, it's an opportunity for health informatics to be able to be implemented as a very viable tool to be able to work with patients on the outside. And example.
Perfect, thank you. Yeah, it seems like there's a lot of things that you got to pay attention to, obviously, when looking at somebody's healthcare. And I know this is something that Pete talks a lot about too, is that it's not just not dealing with just the symptoms, it's looking at the person as a whole. So I think that the example that you were giving there is kind of looking at all those things together as well. I do want to talk a little bit here. I've got some questions just about the academia just in general for the students. So I want to address Dr. Mirzaei. What overarching topics are the students taught when concentrating in this field? Can you talk a little bit about that?
Sure, I'll be happy to. So students who are coming to this field mainly learn about health information management. And then at the same time, they also develop business skills. So our program is designed in a way where we prepare students to learn all the basic medical terminology, metrics, clinical coding that they need. And then along with that, they develop their skills to leverage the technology and then of course, analyzing the data. So students will learn about clinical information systems, standards of healthcare, legal and ethical aspects of it, which is very important for them to know as they grow in their career in this field. And they also learn about database management, data analytics skills that are also very important. So data visualization and analytic techniques that can help them to develop better outcomes are kind of the core that they need to learn when they are coming to this field. And they also learn about data privacy and platform security issues. Those are the kinds of things that they need to develop the know-how and skills.
Perfect. And Sarah, Stephen, I mean, do either of you, because I know we're all talking from different schools here. I mean, is there anything that you guys want to add to that? I don't know how the programs differ at all between one school to the other.
Yeah. Go ahead, Sarah.
Oh, Dr. Rushnick, you're on.
Yeah, I'm trying to do the muting so my voice doesn't appear over others. Yes, also on our end, we're also looking at health informatics. Many of our students are doing double majors as well. First, a lot of our students, first of all, are getting a business background. So they are familiar with the traditional background, which I think is important, of accounting and finance. And many times one of the problems with our healthcare, especially in the United States, is a lot of the health providers don't even know their costs, let alone how to do the pricing, you know, in terms of all the pricing issues here. And on the patient side, many times you don't even know the price you're going to have to pay for a procedure. So they have that. They also have the management and marketing, because this basically on the end of it is a people business. So you need to be able also to communicate, and what are the best ways to communicate. So we're having that, and then they can go outside their field. We have a number of people that are combining that with pre-med majors, or in terms of nursing as well. So we have a number of different fields where they have a number of nursing and health sciences, along with pre-med and computer science. So it can be a combination. So it's not like a cookie cutter. So I think in this field, you can come into it in a number of different ways. You can even come into it just in marketing of health information systems, of informatics versus management versus the more technical area of the coding and the data analytics side.
With Nova Southeastern University, with a master's, it's a master's in biomedical informatics, the program. The core courses kind of cover a little bit of each of the areas. So there is the areas of computer science that are incorporated into that, as well as managerial sciences. We do have project management, Lean Six Sigma, yellow belt students will earn a yellow belt coming from a third party for that. But also, we give them that opportunity to look at the computational informatics and the other piece of that as well. Now, we also have tracks as well embedded within the master's program. So if they wanted to do pure analytics, they have those courses to do that. I recently developed a track in security for our program within the master's program. So now students can take 5 courses, which would have been elective courses they would have to choose from. They can just choose all those security courses and have a track in that security area. Hopefully we'll have that up and running by the end of the year. So we kind of give them an opportunity to really get a foundation with the core, but when it comes to the electives, and we want them to hold off until the end with the electives, it gives them that opportunity to really hone their skills or their path that they feel is the best trajectory for them.
Perfect, thank you. Yeah, that was really helpful to kind of know a little bit about the different courses and classes and degree programs for each of the schools. So thank you each for that too. Dr. Rushnick, I did want to ask, and this is also probably a question for each of you. So anybody that wants to follow up, please feel free to do so. But can you give us some examples of what career opportunities are available for students who pursue this concentration? Then also, I think part 2 of that question is, you had kind of referenced this in your last answer, but are there ideal careers for those that are only, doing undergraduate or masters, or, can you kind of give us an idea of some of the different opportunities there?
I I think there's so many opportunities available, and they're just coming on even further. You can go from the traditional ones, working with a number of health providers and being in their area of data analytics. You can be in the area of companies that are startups or company in terms of health informatics. You can even think about the traditional tech companies that are getting into informatics. A number of our students, for instance, are going to Google or Amazon or Microsoft in their health sector avenues. So you can think about it. And again, because you can come through it, Nikki, in so many different avenues, the possibilities are there. You can even think about it, those that maybe have a finance background will be able then to share and do data analytics on the forecasting and dealing with prices versus those in marketing. How do I get to the patient? And how do I deliver the best services for my customer care? Now, in terms of telehealth, in terms of basically reaching out, think about you now of doing your seminars. Before my work before the pandemic and my research work has been trying to get people to do a hybrid approach. And there's been so much resistance. And the reason telehealth has been like in the background and not in the forefront has been because of reimbursement. It was hard to get reimbursed. Now, because of COVID, that reimbursement is allowed by Medicare and a number of other insurance companies. So that's going to be blossoming. So what are the best ways now? Think about it. When you see your provider, many times even for your preventative care, what's the problem? They can't check my vitals, but now when you're getting a number of devices that you're going to be able to have home devices, even besides your watch and your phone, but a number of devices that you can have, those students can then work with even those companies doing the devices or those companies, those providers, and trying to get that care. So I see it as a hybrid approach. So I see it as enormous capabilities. Even what we think about today is going to be different in a year or 2 years from now. So and you can think about it, some of our students that have been tech people have come back and tried to get the healthcare aspect of it. So you can even think about that, or people that have been in other areas, they want to get, they know their own specialty, but they want to get the healthcare part of it. Does that help?
Yeah, Dr. Bronsburg or Dr. Mirzaei, did you want to add to that at all about the different career opportunities?
The opportunities are vast. I think that Dr. Rushinek actually was really on point. We do see the growth in the technology, and so along with that, the healthcare industry tries to catch up, and so it's a very promising field, and there are a lot of opportunities for our students to capture as they move forward. As you said, the big giant business companies are coming into healthcare, like Apple and Google and what have you. And so the opportunities are really growing. And that's I want to say that people who are kind of interested in this field shouldn't shy away from getting into it, because I can envision that you have a lot of opportunities in terms of career growth in front of you.
And I'll just add something really quick. The world of healthcare and health informatics truly is huge. The landscape from which students can gravitate towards and grow their career is really limitless. I mean, they can go from, you can start thinking of stuff like even project management, and how does that fit into the world of health informatics? Well, if you're implementing an EMR, and getting rid of a legacy system that's been there for a while, you have to be able to put a project together, a full formal project, to be able to get that done on scope and time and within budget, that becomes a major component of it. But that's basically health informatics too. I mean, it's you're working with the vendors, other suppliers, but also the coders and developers and trainers for that particular system. So it goes into that area. And there's even other areas like consumer health informatics. And you kind of think, you know, like, what is that? And, you know, but that's a whole nother area as well, you know, for folks to get involved in. So the world of health informatics, really, it's almost the student's choice on which and what area they want to go into, whatever drives them. There is an area that they can actually pursue and move into and make a career.
Can I add one more point? And this is kind of a plus. You know, you can make lemonade out of lemons, but the healthcare industry has always been a laggard in technology. Think about it. It's not too long, and maybe even now, how many paperwork you have to still do by hand. And, you know, when it used to be, when they used to say electronic health records, everybody said, wow. Well, you know, in the bank, you never had to go to the bank and say, you know, let me fill out a form to see how much money I have in my bank and make a deposit. So they've always been a laggard in that area of technology. So I flip it around and say, there's a great opportunity there. We're thinking about our mobile phone, and you think about any type of way in terms of, we all Google what diseases we think we have, right? And in terms of, Google always wanted to be in that healthcare space. They've gone a two steps back, one step forward, but those are the ideas. And think about it, it's the wearables, you know, that whole area is just going to be booming. So I think in all the sectors, healthcare is just going to be accelerating, because one of the reasons is because they've been such a laggard. There's so much growth they can do just to keep up with what other companies are saying. Hey, that is just a marketplace that we can just capture, and it's just waiting to be disruptive. The traditional way, and when you think about now that we're opening up after COVID, the idea of sitting in a doctor's office for an hour to get a prescription is just not what anyone wants anymore. You know, they won't put up with it. So it's the idea you can think about. Even in TV, you're seeing a number of ads. If you want just birth control, or you want some prescription for ED or something, you know, erectile dysfunction, you know, you can get it. So it's just so opening, and I'm excited about it because there's so many ways to go for it, and for our students, and also the community. And South Florida really has always been a center where that's been investments. You know, when they're talking about that tech hub, they've, you know, in some ways people don't know, hey, is that too much hype that we're talking about? But in the healthcare hub, we've always had the investment coming in to our community, since the shape of our community and how we're doing. So I think we're just going to even go further in that aspect. That's why I think it's so great that you set up this group and even this subgroup, because I think there we can really prosper and be a leader, not only in South Florida, but in the United States and in the world, you know, of coming here for basically thinking about it as a lab.
Yeah, I'm glad you added that, Dr. Rushnick, because it's funny, you started out by saying that basically the opportunities are endless, and I was literally just thinking that in my head, so you like took it from my head. It was perfect. But as you're talking, I'm watching everybody else, and I'm seeing a bunch of head nods, so I think everybody's in agreement with what you just said.
It's an opportunity that, you know, Nikki, you should take on. That, you know, we think about that South Florida, which is really great, but you can even expand it and say, hey, we can be a leader for other people or other communities. You can have how it's being done and bringing those in. I'm working with a number of companies from Israel, for instance, and they, you know, they're quite big in tech, of course. And one of their areas that they've really focused in the COVID, you can see how they have really done well with the Pfizer and the vaccination. But beyond that, they've worked a number of their technologies into healthcare technology. We're talking about vision, we're talking about automation, even automation in terms of, you think about you know, you've all heard of Waze, right? And you think about that automation or the autonomous vehicle. They're taking that same technology into, for instance, surgery, where you can basically take interventional radiology, and from the wrist, the surgeon now puts a catheter all the way down and can go even into the prostate or anyways, and basically reduce it. You can do the same thing where you can have robotics and have, you know, what the path is, and you can have then the robotics go down. So you can see a number of ways in which I see, Nikki, that you can reach out to a number of these vendors, not even local vendors, where I see you have the local sponsors, but rather even other from around the world coming and basically communicating with you. And you can think about it and offering South Florida to be a hub, that you can make that even almost think about it as a lab, and you can use the universities from Nova to FIU to all of us having also on the medical end too. FIU and Nova has that, we have it. So you can almost blend those together and make it as a lab and say, hey, we're working with that academia. What the advantage is in my research, it's always been involvement with the community, with basically the business community and the vendors together, and seeing how we can do that collaboration. And that hasn't been done enough. Even though it's been done, it's still almost siloed. And the world no longer is siloed, my dear. Just like we're not going back after COVID in healthcare, the consumer is not going to allow it. You know, it's almost like the idea where people are saying, my workplace is going to be changed. If I don't need to be at work, I shouldn't, and I can be productive. Let me be productive. It's like on demand. Let me be productive anywhere. So it's the same thing with healthcare. So I think that's a way that you can look at it. I'm thinking about even besides that, of how we can grow your organization. I'll be happy to talk to you about it in the future. Is don't even look at it. You have to have a sense of community, which is great, you know, that physical, but now that you're basically broadcasting live to Facebook, and you can do it to LinkedIn and to YouTube, you can get the whole world there to see what you're offering and see the talent that we have. And now our students don't have, if they want to stay in South Florida, they don't have to have a job necessarily in South Florida. Exactly. They can reach out, and it could be a hybrid type of approach. So we need to look at the world more and that interconnection of what it is going to be. I think that's where you have to kind of shift our focus. Many times, for instance, people have asked me to go, even your folks, you know, to go to, you know, Fort Lauderdale and Palm Beach. And I said, you know, 5 o'clock, there's no way after my class, I'm going to make it physically there. And I used to say, can't I do it remotely? Well, we're not set up. Well, now you are. Right. So that's how you have to think about it. It's the hybrid approach. I miss people, but there's places that I say, hey, my Zoom is just fine.
Yeah, well, and you brought up an important point there that I wanted to bring up again, so we didn't skip over that, was just how the pandemic has really progressed all of this and changed the landscape. I mean, I'd love to hear from you and the other panelists is just how do you think that that COVID and the pandemic has changed the industry, changed even just maybe how you're teaching the students, like maybe what opportunities are open? Because I think that, you know, like Dr. Rushnick said, is that especially, you know, the patients or the customers, I think that once we've seen what's available and what can be done, we're not going to go back to the old ways or accept that. So I'm just, you know, I would love to hear from you guys on how you really think the pandemic may have changed our future in health informatics and of course, just healthcare in general.
If I may start, I think the pandemic just worked as an accelerator for everything that we were doing. So we were going towards our MSHIA program is fully online. But like if we just talk about generally for other programs as well, this pandemic kind of taught us that we can work online, we can work remotely without really facing a lot of challenges that we were maybe kind of very scared before this happened. So we were thinking that, oh, we have to do these things all face to face. And then we realized that no, we can be a lot more productive when we're working online, and we can manage our time even better. So the main impact of the pandemic, of course, we don't have that face-to-face interactions, but I don't think our productivity is any short of what we had prior to the pandemic. So I just believe that it's just worked as kind of an accelerator for everything that we were doing.
Perfect, thank you. And I did get a question here in chat that I wanted to address. So Karen had asked, she wanted to hear the panel talk a little bit about making healthcare pricing for patients more transparent. And is anything being done in that? I mean, I don't know how much you guys know on this side of it. I'm sure that you guys are, you know, very much involved with that, even from the school side, but can anybody kind of speak on transparency for pricing for patients?
I can speak a bit on it. It's been now even, pricing has always been the thorn in every consumer's, what can I say, butt here. And it's been also one of the industries, when I talk about laggards, it's been one of the industries that when you go to get a service, they say, I don't know how much that's going to cost. Can you imagine going to a mechanic and, you know, you say, okay, how much is a tune-up? And they say, I don't know, you know, we'll have to check and get back to you in it after it's done. So that's been even by the government. The US government has, in Congress, have required some transparency. But what's interesting is the providers are, I don't know if you're aware of it, that have tried to make it transparent and make it difficult for the consumer to find the pricing. So they've even done a study where there's certain tags, you know, in SEO, in search engine optimization, where there's tags that you want to flag to get more traffic. What the providers have done is to hide those tags. And basically you have to drill down so deep to get those prices. So it is not here today. And probably, I think it has to come from the consumers again and make those roars to say, hey, we don't want it just by the letter of the book, but actually make it transparent that it's easy to do. But that's a great issue here.
Nikki, can I say something?
Sure. Is that Bert? I recognized your voice.
Yeah. Bert Vorstman, urologic surgeon, formerly faculty member at the University of Miami. We are developing a cost transparent healthcare marketplace. We're about to launch it in the next week or two. One of the biggest stumbling blocks in terms of pricing transparency are healthcare laws and the health insurance stranglehold on healthcare. With all sorts of self-serving laws. So in order to launch this cost-transparent healthcare marketplace for routine care, we've had to jump through all sorts of legal hurdles and pay a lot of money for legal advice. And it is the only industry that is burdened by self-serving healthcare laws, by self-serving laws. And this is also one of the reasons why these big tech companies like Google and Amazon and Watson IBM have all sort of backed off because in order to play in the healthcare industry, you have to play with the health insurance industry. And the health insurance industry is your doctor. It's not the doctor that has to keep asking some non-medical intermediary for authorization. The health plan is your doctor. And we're trying to sort of circumvent all this. And with our startup, we will not be playing with the health insurance industry, particularly because 2/3 of all the healthcare delivered in the US, and it's a 3.6 trillion market, 2/3 of all that healthcare delivered is routine office-based care or outpatient, okay? And it's only a fraction of healthcare consumers that take up all the healthcare dollars for inpatient, like Mr. Bronsburg outlined with his chronic disease patient. Most patients pay much more for their health plans than they ever get in services.
Right.
And you know that's correct because the health insurance industry is making out like bandits.
Yeah.
There was an article just recently where the medical director for United walked away with $42 million. It's a scam.
Yeah.
So we
Bert,
have to change a lot of the healthcare laws, because there's different laws in every state, and there are federal and state laws, and they're not for the benefit of the consumer. They are all for the benefit of the health insurance industry. And in my old practice, there's been a rapid movement away from telehealth. It is not the panacea. Telehealth cannot fix a broken leg.
right,
you
you
know,
still have to be with the patient.
It's great for people that want a prescription refill, but there are a lot of things where you still have to see the doctor.
Yeah.
And the other thing that the health insurance industry will do, it will monopolize telehealth. And like I can remember in the days when we were doing lithotripsy for stones, the shockwave came out in the early 80s. It was an absolute godsend because we didn't have to take the knife to patients to remove stones anymore. And the reimbursement by health insurance companies was very generous at that time. And you know what happens with the health insurance industry once things take off, wham, they control the costs, and their reimbursements are just shameful.
Thank you, Bert, for that too. And I feel like this could probably, again, I always feel like when we're having good discussions, that some of this could be its own discussion in itself. So I wanted to thank you, Bert, for that. I think that maybe Karen and Praveen would be good connections for you afterwards, because I know they've got some questions there in chat, but we've got just about 5 minutes left. So I've got a couple more questions here that I do want to finish out with. But again, thank you so much, Bert. And Bert, if you do want to drop your information in chat as well, again, I think there may be some people there that might want to connect with you. But I did want to ask, you know, Dr. Mirzaei here is going back to, you know, the students and what they're learning and the careers that are available to them. One question that comes up more and more often, I feel, especially when you're talking about health informatics, is data science is becoming more and more popular, and of course, more of a viable career every day. But is it enough to be a data scientist to work in the field, and what other skills may be needed to be successful within health informatics?
That's a very good question. I would say not enough. But I can also say that it's a tremendous help to your progress. If you're coming from that background, it's a tremendous help because you already have acquired the analytics skills. But coming to this field, you need to learn medical terminology and quality metrics, as well as legal, ethical aspects of dealing with health information. So coming from data science background, you may have the analytics skills, but you have to learn the context to be able to leverage that knowledge and then interpret those results that you get out of your analytics for this specific context. Basically, you need to learn the social behavior management policy aspects of health data and information.
And I think even what Bert had said is the area of not only of the laws, and you know everybody's heard of HIPAA, but the restrictions on data. our issues, and the privacy of issues. They have the wall of shame. The government has listings of everybody that were breached, but the problem is with the government, nobody even knows that that page. So that wall of shame isn't shameful because no one even knows that it exists. So there's issues also on the healthcare laws that are important, let alone just the regular data that we know we need to have the data privacy.
Exactly.
Getting folks that really understand healthcare and the processes, as well as data and analytics, is we say it's kind of like finding a unicorn. There's not that many of them out there that really understand both comprehensively. So that is the definition of an opportunity for students to really brush up on those skills, and they can pretty much write their own ticket wherever they're going in the country. For a career. So that certainly is an opportunity. Data is a real interesting subject matter in itself, and you can have a complete bunch of seminars on that in and of itself. But the other thing about data is we have so much data, especially with our electronic medical records and how much information we've gathered, and we now have it sitting in these big files, the cloud, wherever you want to call it. Tons of information. We are data rich. Unfortunately, we're information poor. We're not working enough with this data we have. We're not cleaning this data. We're not making this data work for us. So that is another area of data that is of concern, but also, security of this data, and, with the amounts that we have, and we all know what's going on in the world of cybersecurity and ransomware and all of that. And that again is another wonderful seminar that one could have. But those are issues with data.
Thank you, Dr. Bronsburg. And I did want to ask you, because I know we've got just about 60 seconds left here, but I wanted to see if you could give us a brief overview of the HIMSS chapter, because I definitely didn't want to leave that out, and just maybe what are some of the opportunities with HIMSS that the students can get involved in. I know you guys have like a scholarship. I wanted to see if you can talk about that a little bit for any of the students that maybe are not aware that we even have a local chapter, what you guys are doing.
Yes, we have a local chapter of the South Florida HIMSS. I encourage all students in the areas of health informatics, biomedical informatics, pursuing anything along those lines to become involved with HIMSS. You can do that through an organizational affiliate with your college or university. I am sorry for the barking. But HIMSS is a wonderful organization. Bacetto, shh, bacetto. He's not going to listen to me. But it's a wonderful organization, and for students to get involved, it's a great networking opportunity. And we have a lot of events going on. We do an educational event once a year with the student and professionals. We just had it not too long ago. I brought in a couple of speakers on Six Sigma that were black belts and did a wonderful job. But we also have a golf tournament which raises funds for the scholarship. The scholarship is wonderful. You apply to the scholarship, eventually someone is picked. That scholarship is like $5,000 to the student, plus wherever the national conference is, they will bring you there, travel and back, and house you there for a few days and feed you for a few days. So a lot of wonderful opportunities there for students to get involved.
That's awesome. Thank you so much, Dr. Bronsburg. And don't mind, my dogs, they bark at every other meeting that I'm in too. They don't listen to me either, so it's okay. But that is about time for us this morning. Again, I think there's so much stuff that we could talk about. We are going to have a couple more follow-up panels to this within our Health Tech and Life Sciences group. So stay tuned because we will be pushing out those shortly. And thank you again to all the panelists this morning. And of course, everybody that joined us bright and early on a Tuesday morning at 8 a.m. And hopefully everybody has a wonderful day. Thank you so much, everybody.
Thank you very much. This was wonderful.
You're welcome. Thanks everybody for coming.
Bye-bye.
Thanks.